Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Dr. Jim Finn, Vice President of the Australian Medical Association, Queensland. Today, we're going to talk about his organization that offers strong leadership through advocacy and support for the medical profession, and in turn, for the benefit of all Queenslanders. Without further ado, welcome to the show, Jim. It's so nice to have you here.
And thank you very much for having me.
My pleasure, Jim. So, Jim, please tell the audience more about yourself and something about your background.
I'm an addiction specialist. I work in Queensland mostly in public practice. I've been working in addiction, this is my 9th year, and before then I was a general practitioner for about 9 years. I've been based in those days rurally in Roma and Dirranbandi in Western Queensland. Currently, I'm Vice President of AMA Queensland. I have been for the past year. And before that, I was a Board Director of AMA Queensland. And AMA Queensland is a peak medical body which exists to advance the professional interests of doctors and the health of the community. It's an independent organisation representing more than 6,000 doctors across Queensland, from residents and registrars to public and private specialists and general practitioners.
That sounds very interesting. So tell us, what is your big current event, issue, or strategy? So what's going on with the AMA nowadays?
The AMA believes currently we need a cultural change in hospitals. We really believe that we can achieve that by adopting the Tristan Jepson guidelines, memorial guidelines for cultural change within hospitals to really help things. And we believe that while funding certainly is needed for Queensland hospitals, we need a cultural fix too. And the doctors can only do their best work in positive, supportive workplaces. And that means sensible workloads and a focus on treating patients, not paperwork. We do know that 90% of our junior doctors work unrostered overtime. 47% of our junior doctors, when surveyed, have seen workplace bullying, discrimination or sexual harassment, and the level of depression and suicide in the medical community are unacceptable. We want all Queensland hospitals to introduce workplace guidelines that are specifically designed to improve culture. And these guidelines are used around the country, and it's time Queensland caught on to the guidelines. So the load on our hospital system is getting heavier, and we need to make sure our doctors can carry that. If we want better patient care, we need fundamental change to the way hospitals treat their staff. And AMA Queensland is a signatory. We've signed on to the Tristan Jepson Memorial Foundation Guidelines, the Workplace Wellbeing Best Practice Guidelines. And they're a comprehensive list of cultural change, multimodality across workplaces, and they're based on Canadian research, and we're fully supportive of them.
That sounds very good. Now, Jim, if you don't mind, can I ask you a personal question?
Absolutely.
Why are you so passionate about medicine? What made you decide to become a doctor in the first place?
When I first wanted to become a doctor, because I was actually a physics maths teacher beforehand, it's ironic in a way that I initially became interested in infectious disease. Becoming interested in infectious disease, I had this naive concept that medicine was basically about treating infection. And I became a doctor to assist people and treat infections and things, and I found it so much more than that. I mean, in addiction medicine, like general practice, is a very, very broad field where we treat the entire person holistically. And it's not medicine which is mostly just about treating infectious agents. It's about treating the lifestyle of the person, the substances in their life, the entire biopsychosocial model. And made me initially interested in medicine wasn't where I've gone in medicine, and I'm quite grateful for that. And if I could add that, what got me into medicine was to treat the whole person. And the reason I became into addiction medicine, I was lucky enough as an intern to work at the HADS unit at the Royal Brisbane Hospital, and I saw the transformative change that they were able to achieve to take people who, because of substances, had some chaos in their life, assist those people to get structure in their lives, and also to assist some very, very high achieving people, professionally very highly achieving, modify their lives to be even better at achieving by removing substances from them. So it's that transformational change that I really wanted to be a part of.
That sounds wonderful. Thank you so much, Jim, for sharing your story with all of us.
Oh, thank you.
Now, Jim, let's go back to AMA in Queensland. What made you decide to join this particular organization?
I was lucky enough to join AMA Queensland as a medical student and have continued my membership ever since. And the reason for that is I believe that there is a requirement in the state, every state should have a medical organisation which is broad in scope, comprehensive if you like, across all specialities, and it needs a peak organisation to advocate for public health and best practice within the hospitals and the wider healthcare community. And AMA Queensland is the one that's suited to be able to do that. It's not representative only of one group of specialists. We have residents, registrars, private, public practice specialists, and general practitioners. So the entire spectrum of healthcare, we've got members across all those modalities, and it allows us to advocate for the physical and mental health of Queensland and the public health, structural infrastructure changes and modifications in our hospital to strive for excellence to improve the health of Queenslanders.
Sounds excellent. Jim, I'm sorry to tell you, since we're running out of time, but before we go, what is your main takeaway message to all of our listeners out there?
My main takeaway message to all the listeners is AMA Queensland is very supportive and is a signatory to the Tristan Jepson Memorial Foundation Best Practice Guidelines. We have too high a rate of mental health amongst doctors in Queensland and across many workplaces which have very high levels of stress on the workers. And stress is getting more and more in the healthcare community. And we need Queensland Health to sign up to the Tristan Jepson Memorial Foundation Best Practice Guidelines to show that it shares the values at AMA Queensland and many other organisations like the Law Society of Queensland and the University of Queensland share. They should sign on to these comprehensive guidelines to enact cultural change to improve the working lives of our health professionals within the hospitals so they can care for the health needs of Queenslanders to an even higher standard.
That was an excellent message, Jim. It's good to know that AMA Queensland really cares about the health of all Queenslanders.
That's the reason AMA Queensland exists.
Excellent. Now, Jim, before we go, for those who want to contact AMA Queensland, how can they do that?
If you just go to our website, if you put AMA Queensland into any search engine such as Google, you'll find it there, and you can go into that search engine. It'll come up with our phone numbers and everything. Just to contact us, you can email or phone in, and we've got reception staff ready to take calls. And if you'd like to know anything about the Tristan Jepson Memorial Foundation, that's available on the net as well.
That's wonderful. Thank you so much, Jim, for coming on the show. It was fantastic having you.
Thank you so much for your time.
And that was Dr. Jim Finn, Vice President of AMA Queensland. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.